level, this project's goal is for COPI, the Quality Oncology Practice Initiative, a data registry offered by ASCO, to collaborate with electronic health records in order to do two things. One is to provide electronic health record vendors with a abstraction burden reduction tool so that they can ultimately upload it into their EHR system so practices can use the tool. And the second arm of that is to work with the vendors that we're already working with the abstraction burden reduction tool and provide them with the data elements list that we know we need in order to capture and accurately map the measures that are in our qualified clinical data registry, which is used for reporting to CMS for the purpose of reimbursement. Now, the objectives will obviously be met through deliverables and tasks and milestones, and those are all very clearly delineated in the project report, but I'll just go over a few just to talk some high level of what we're trying to get at. We have the major blocker currently right now is engaging with electronic health vendors because they're just not responding to the requests via email for this collaboration. We have one that's responded, and we've gotten so far as the non-disclosure agreement, but we haven't really been able to get past that step. So there's going to be a lot of work that needs to happen in order to get the statements of work done, to get the tool to the vendor, to embed the elements into the EHR eventually, and then inevitably do these educational roundtables with the practices. Similarly, with the QCDR arm of this project, we have the same kind of blockers and issues because we can't get with the EHR vendors, but the only difference really is instead of an abstraction burden reduction tool, we're just giving them a list of data elements that they have to capture. So the summary of all of this really is that the results are to be determined. There's a lot of anticipated barriers and risks, and that's with both arms of the projects. Engagement being the highest one that I'm running into right now. The cost issue, we really don't understand what that is, right? Because at the moment there are no costs other than time. There's timeline issues, any other legal delays, and inevitably a lack of buy-in, but practices are asking for this, so I'm not particularly worried about the practice buy-in. It's really the EHR vendors. The analysis of the data is really through surveys. So it's surveying the practices to get their input to see if, how much time it takes right now, and once the tool is implemented, how much time will it take them or has it taken them? And also it'd be good to get some cost ideas if they've been able to save money because of the reduction of time here. So where this is all headed, and for next semester, or the work that I'm going to have to do, is obviously continue all of the work that I'm trying to do because I'm stuck with the EHR vendor piece. But inevitably, the goal is to continue implementing the process plan to drive the importance of quality and electronic health record collaboration. The goal of this improvement project is really to help providers get back to their patients instead of doctoring their EHRs. They get to doctor their patients. I'm going to keep engaging with the EHR vendors. With the one vendor I've got on board, we're going to get the kickoff calls going again, share that abstraction tool once we've got the legal agreements that we need in place, and then start working with the practices of that EHR vendor to let them know that we've got this collaboration going, and we get to move forward with that. So it's a pretty exciting time. Again, I'd like to thank the class, I guess, for the opportunity to take everything that's been in my head about this project that I was working on well before I started the program, and actually be able to put it to paper and walk through the journey of the charter onto this report. And I'm really looking forward to being able to present this as a capstone. I don't know how much I'll have to present, but I'm looking forward to the topic because I think a lot's going to change in the year coming, because electronic health records are simply just going to have to collaborate with us, because this is all coming down from CMS and the government, and these are requirements that practices have to meet. So if they don't meet them, you're going to hear a lot of uproar in the community, I think. So thank you. If you have any questions about my project, please don't hesitate to ask.